Universal healthcare is terrible. Hello, Rumble. I'm Nick, former medical doctor turned soul doctor. And I know that this probably isn't controversial to you, but it was controversial for me to say. I grew up thinking, because I grew up in Canada as well, thinking that universal healthcare, that is amazing. It's a privilege, it's a right, and it's amazing that we have this resource. And in a way, it is. I'm so grateful. I grew up quite sick, needing antibiotics, needing asthma medications, needing steroids. Apparently, I had possible meningitis when I was a kid, all this stuff that required lots of intervention. And you can go back and say, did you really need all that stuff? But let's just be clear. I used that, I had that, and I had coverage as well. And that's the other thing. Healthcare coverage is terrible as well. And the reason I say this, and I want to expand this hypothesis, is because these incentives shift how we deliver things. And we already talked about, or we already talk about, this is really sick care, this is really disease care, this is really symptom management. It's not health care in terms of health, vitality, wellness. But when we look at it this way, and when I was training to become a medical doctor, especially here in Canada, I was never worried, how will I get clients? Because it's covered. I already knew the clients would come. If anything, it'd be too many clients. How will I get paid? Well, I'm already going to get paid by the government because that's how it works. I never thought, how do I need to improve things? What might not be working? What might be better optimized? Because there's actually not the same incentive for that. And then I recognized I've always had coverage, healthcare coverage in a way, because my dad was a doctor. So we always had, and worked for the public system, we already had some kind of extended health insurance. So the things that are recognized, like going to see your optometrist to get glasses, or going to see a counselor, or going to see someone specifically for physiotherapy or massage therapy, if you're an RMT, those are covered. And so those would be the first lines of treatment, because it's not so much what do I think is going to serve me the most, but what is covered and more than free to me, because we're so not used to paying for that care. And now that I work as a soul doctor and I do Ohana breath and Ohana sage where none of my stuff is covered, I've had to be really clear about who I am, what I am, how I do things. I've had to be really clear to people, if this isn't worth it to you, do you really want to do it? And I've had people be like, I really want to do this, I love it, but I can do this other stuff where it's covered. I'm like, that's okay, I can understand. I've been playing that game so long too. And it took us years for my beloved and I to be like, we're not trying to just maximize our health insurance. Be like, oh my God, I had $1,500 to spend in this and I didn't spend it. Rather, our time and our energy are valuable. Why are we going to go see a practitioner if we don't actually believe that that's the best use of our time and energy? And so right now we've got an amazing traditional Chinese doctor we go see, great acupuncture, everything else like that. We've got a great naturopath who gives Bowen therapy. And after that, I don't know if I've seen anyone recently, even though I used to love going for massages, it's finding a great RMT that provides a massage I'm looking for. And then also recognizing if I don't need it, why am I going after it? And I'm paying for a number of things. I'm paying for breath alchemy right now. I'm paying to do breath work, right? I have paid for different retreats, things like that. And those ones aren't covered, but I know that's the most valuable use of my time. And I say this because how do we create the world again where we bring things back into balance? One of the reasons why there's so many optometrists, eye doctors, I imagine, is because it's covered. And so now sometimes it's the de facto way to go, even though some people may not actually benefit from glasses. There may be other ways to create sight again, but it's not covered the same way. And some people, the best massage therapist, the best one I have right now, she's not actually an RMT, but it is so good that we've been paying for that, even though we have coverage. I probably spent over $5,000-$6,000 on that last year. And I realized that it's such a funny concept. And then I realized that so many of us are trapped in our therapies, not because it's the best thing we think for us, but because it's both covered, or it's acceptable, or it's to validate or prove or get approval that I'm going to go see someone who has a certain level of skill. And the problem as well is that everyone in these systems has to be certified in a certain way, which means that sometimes the best people who could work here are not able to because they have gifts, but they don't want to jump through the hoops just to prove that they have the gifts. And then some people who may not actually be very gifted in that area were able to jump through the hoops just so they can have the certification. And so I say this because how do we reimagine the system? How do we step outside of the way things are? Part of it first is just stepping outside of just choosing things because it's free. Part of it is stepping outside of the old way of insurance and thinking, how do I create insurance differently? Because it is a wonderful thing that we don't go bankrupt when we need some kind of therapy. It's wonderful to have hospitals that are great at treating acute sick care. It's a lot of the long-term care, especially when they're like, we have nothing for it, right? Like IBS or fibromyalgia or things like that. That really, can they step outside of that and say, how do we get funding outside of this? Because it just isn't in the realm of regular medical doctors to deal with this. I know, I used to be in that side going, oh my God, I've got this patient coming with this. And that's how we were trained because we didn't know what to do. We didn't know how to look at nutrition differently. We didn't know how to look at sunlight, water, magnetism differently. It's not the way we're trained. But the things we're really good at, okay, there's something acute. I've got an algorithm for that. I got a way to manage those symptoms really well so you can actually come back to a much more normal way of functioning. And from there, you might have some wisdom. Okay, let's maximize that. And why is it that we had all these different healthcare modalities before? Because they all had a place to play, whether it's homeopathy, whether it's sound therapy, whether it's breath work, whether it's energy work, whether it's forest bathing now, whether it's cold thermogenesis, whether it's sweat lodge sauna. All of these things have a reason. And I'm so grateful that now I explore these modalities, not because I have them covered, but because I've met someone who can share about their benefits, and I feel like there's a reason why I need to explore it. And recognizing that every practitioner is different as well. Just because I go see a sauna isn't the same as a sauna isn't the same as a sauna. A wood-fired, cedar sauna in the wilderness is so much better for me than a sauna in the middle of the city that is full of EMF and everything else like that. And recognizing that I'm sensitive to that. Okay, what are our sensitivities? What matters to me? And how do we have practitioners who are really passionate about what they do, as opposed to how are they trying to fit in the box so they can actually get paid easily because they know they've got coverage and they've got unlimited number of patients? And how do we not play the system where all the payments, the prices, everything else is actually truly set by the insurance companies, which their motivations, their incentives are opposite to ours. I'm looking for how do I become healthy, free, vital, enjoy life. Theirs are how do we both take in as much money as we can and pay out less so we can make profits. I'm not going to say as little as possible because they recognize now they pay out as little as possible. That may be a short-term gain but a longer-term pain. They're balancing that. They are on a balancing act of that. And especially with all the different kinds of insurance, because I've had disability insurance. I've been on disability insurance before, especially when I left medicine, I was completely lost. A lot of that is jumping through the hoops to prove myself to someone else that I'm doing the thing that you think I'm supposed to do to get better, but not actually the number one thing, which is actually just getting better. And that's why the second time I actually had the opportunity to go on disability, I was like, fuck it, I'm going to quit. I do not want to have to pretend to be a certain way. I would rather just leave that system. And it's funny that I did that because it made zero financial sense. It made zero logical sense from the way I've been taught. But I did it. And I'm really grateful I did that. And so how do we jump outside of these systems? I don't have all the answers. I definitely don't have all the answers. But I'm willing to plant the seeds and propose because I think collectively our intuitions will create something more powerful. Ciao for now.